I'm Jennifer Goday, and I'm a nurse practitioner. I own Everyday Wellness located here in Wichita, Kansas, and today I'd like to talk to you about something called Andropause. So, what is Andropause? Most of us are familiar with the term menopause, which is the natural decline of our sex hormones over time. Now, the same thing happens with our men as well. Only for them, of course, we call it andropause, which is really just a slow, natural decline of your testosterone as we age. Now, what are some symptoms of that? So today we're going to be talking about low energy, struggling to find the motivation to go to the gym. Are you struggling to see the gains in the gym? Maybe a little bit of erectile dysfunction, decreased libido, decreased muscle mass, things of that nature. So if any of those are pinging true, get excited because that's what we're going to be talking about today. So again, that's a brief kind of explanation of what andropause is. It starts in about our 30s and 40s usually, and oftentimes we kind of just chuck it up to aging, right? I'm getting a little bit older. It's normal to feel a little bit more tired. You know, I have to work, I have a marriage, I have to raise the kids. I have so many things going on, just like our females. And so we start relying on outside sources for energy drinks, coffee. We're getting pulled in so many different directions, and we think that really if we could just sleep more, if we could just drink one more cup of coffee, we're good to go. But really, there's a lot more to it than that, and we can do things much more naturally to get you feeling like your old self again. So again, that's what we will be talking about a little bit more today. This is very slow. It doesn't happen over time. So I think that's really kind of is one of the biggest issues is it's not like you wake up one day and you think, wow, something has drastically changed. I have to go see the doctor. It really is slow and gradual. It happens over years usually. And then one day, like for me, when I experienced my menopausal changes, I was like, wow, I really just don't feel good anymore. What is wrong? And I also went to a provider and they ran some tests and they said, you know what, everything looks normal. You know, try to sleep more, maybe lose 10 pounds and come see me next year because everything looks good. So what I kind of focus on in my clinic is more from a functional medicine perspective. So we don't really like to just say, here, I have a symptom, here's a medication to help with that. We really focus on the root cause of your symptoms. So what that process looks like if you go into the clinic, whether it's with me or another functional medicine provider, is you're going to come in and we're going to really talk about your symptoms. What is happening on a daily basis for you? What is bothersome to you? And then we're going to take all those symptoms. We're going to do a brief exam, right? Make sure your heart and your lungs look good, your circulatory system is good. And then, of course, we're going to do a comprehensive lab panel. So we're going to look at a lot more things than we usually do in traditional medicine because we really, again, we are hunting for that root cause of your symptoms. So in my experience, a lot of times by the time men come in to ask for help is usually when it is erectile dysfunction related, because then it's really affecting your relationship and often your day-to-day life, right? So we're going to do an exam, we're going to get your symptoms, and then we're going to do a comprehensive lab panel. So what that looks like is we're going to look at your cell counts. We're going to look at the shape and sizes of your cells. We're going to check your organ function to make sure all your kidneys are functioning well, your liver looks good, pancreas looks good. Then we are going to look at a full thyroid panel because what I have found in traditional medicine is we kind of just do the basics and a lot of stuff can be going wrong before those basic lab values can get out of whack and start saying, hey, look at me, we have to start treating things. So for example, like that thyroid panel I was talking about, usually we do something called a TSH with a reflex to T4. In our panel, we're really going to be looking at your TSH levels, we're going to look at your other thyroid hormones, and we're going to look for some autoimmune disorders of your thyroid as well. Because even though that can go untreated for quite a while, you can be symptomatic, and that's what we're wanting to treat, you, the person. We want to get rid of those symptoms. That way you don't have to feel miserable by the time you come into the office to get help. In addition to that thyroid, we're going to also look at your vitamin D levels. We're going to be looking at your vitamin B levels. And then, of course, we're going to be looking at your sex hormones as well. We're going to check that prostate level to make sure your PSA is in a safe range to get started. And then if everything looks well, you're a good candidate, then we're going to move forward with your treatment plan. So what does that treatment plan look like for you? Well, it may look different than your brothers. If you've been talking to your family members, neighbors, friends, this is not a one-size-fits-all treatment plan. It's not like, hey, I have erectile dysfunction, here's some Viagra, you're good. No, we are basically going to look at all your levels again and your symptoms, and we're going to say, okay, we are going to start here. So of course, I like to specialize in bioidentical hormone replacement. What that means is we're going to be using hormone replacement that comes from natural sources, whether it be yams for estrogen or soy for testosterone. And then what we do is we get these little pellets. They are very small. They look like little grains of rice, and we implant them into the fatty layer right above that glute muscle in the butt area. So all you do is we get that implanted there. It's a very, very small incision. It is fairly painless. And then what happens is capillaries form around those pellets that we implant. That way, every time your heart beats and blood flows over that pellet, you have the same amount of hormones circulating in your system all the time. Versus maybe if you're taking injections or if you're doing a troche, like a little medicine that absorbs in your gum line, you really have to, again, remember to do it either twice a week or daily, depending on what those options are for you. And then you have to worry about, okay, here's a bump of your hormones, but now they're going to decline. So then your hormones are doing this all the time. I love my pellets because you don't have to remember to take it. I'm going to implant that for you, or the provider of your choice is going to implant that for you, and it's going to be set it and forget it. You don't have to do anything. And then over time, as those hormones are nice and steady in your body, eventually all your other hormone systems that have been out of whack because your sex hormones have been tanked, everything is going to slightly optimize over time, and then you're going to start feeling better. So I've had men tell me that it feels like the fountain of youth. So again, we can't stop time. We can't, go back in time, but we can definitely get you feeling better. That way you can just enjoy the rest of your days that you have. So what will you expect? Well, you're going to expect to sleep better. You're going to not have as many mood swings because, again, your tank is basically running on empty. So we're going to fill up that tank again. You're going to have good quality sleep. You're going to have more motivation. You're going to see those gains in the gym that you used to see in your 20s that are just really hard to obtain now that we're in our late 30s, 40s, 50s, however, right? We work our butts off in the gym, but just nothing happens anymore. So when we get those testosterone levels up again, you'll see the gains in the gym, and you're just going to overall feel much, much better. Those mood swings, again, can happen with this roller coaster. If you're struggling with maybe a little bit of depression, or maybe just don't feel like I've always been this really happy person, motivated person, and I don't know what's happening. Well, don't just take an antidepressant. It really could be that your testosterone is low. So I've had a lot of people, just even their mentation and their mood improves on pellet therapy, which again is just a form of a delivery method of bioidentical hormone replacement. So also another very common question is, how often do I do this procedure? Well, for men, you guys are lucky. We only do it twice a year. So talking about seeing me, again, twice a year versus having to come in every 3 months or every month, getting injections. So my advice to all my men is, if you're having any of these symptoms that we talked about today, find someone in your area that is specializing in bioidentical hormone replacement, because it's a whole different perspective of treatment, and you will feel much better. The side effect profile for pellets is much, much safer compared to synthetic hormone replacement, and the benefits are going to be great. So you will not be as at risk for cardiac disease. You won't be as high risk for prostate issues, because the potential of these things happening with these natural sources is much, much less than with synthetic forms. And one final thought that I would like to touch on is the stigma of talking about these issues. You know, I'm a female, so I tend to always obviously relate to other females. I've gone to providers that, again, I previously mentioned, and I hear it from a lot of my female clients, is the doctors are just not listening to me. They're not hearing me. In my experience, by the time somebody comes to me with a issue, to me that means you have been thinking about it for quite some time for you to actually do the research, contact me, and come into the office. So if you are at that point, please do not feel weird or embarrassed or any kind of way about coming in to talk about your health, because it is a very big part of life. Even if all these other symptoms are not pinging true, and it is erectile dysfunction, that's a big part of your life. And I want you to be successful in your relationships. I want you to be confident in your body, and most providers feel the same. We want you to feel better about yourself. So please, if this again hits true for you, or you're interested in this at all, don't be embarrassed. You can literally, if you are in my area, go below, check that video description. There's a link down there. You can click that link and sign up to have a consult. We can talk about these things and see what your options are. And again, if you're not local to me, reach out. I love BHRT. It is a brand that I use personally with my hormone replacement. There are several brands out there and providers using other methods as well. Reach out to a functional medicine provider today and get on the track to feeling like your old self again. All right. Thanks for joining and watching. See you next time.